Good afternoon, everyone, and welcome to the UMMC 57th Anniversary Celebration Dialogue Series, Research That Touched Lives. To those joining us for the first time, this is a dialogue session hosted by the Clinical Investigation Center in conjunction with their anniversary celebration. In this session, we feature principal investigators, aka researchers, who will share how their research makes a difference in our community. Today, it is my great pleasure to introduce our distinguished guest, a senior consultant neurologist at UMMC who specializes in Parkinson's disease and movement disorders. With over 15 years of leading major research programs, he has published widely in international journals, and he currently serves as the chair of the International Parkinson's and Movement Disorders Society Asian Ocean section. His work reached clinical excellence in global leadership in advancing Parkinson's care and research. Please join me to give a warm welcome to Professor Dr. Shen.
All right. Welcome to the PD team. I think this is important. So, now there's no screen for me to look at, so I'm going to have to turn backwards. So I'm just going to give a brief introduction about what we've been doing in the Parkinson's team. Can we have the next slide, please? Okay, so Parkinson's is, really one of the most common neurological disorders these days. It's, if you look at some of the surveys that have been done, it's the fastest growing neurological disorders with this so-called GBD, Global Burden of Disease Survey. So this term of Parkinson's pandemic has already been used before the COVID pandemic. Become familiar with the pandemic. Next slide, please. So this is just an example of a patient. You can see who has improved significantly after treatment. So this is a slide, this is a video showing him before treatment, and he's very disabled. I'm asking him to lift up his arms, which he cannot even do. So he has very obvious tremors, problems with movement, so akinetic, and basically needs his wife to help him perform all of his activities of daily living. So he's very disabled. And the next video, you can just click on it. Yeah, so that's running. And you can see this is 1 year later, and the patient is on treatment. So there's a very obvious difference in his condition by giving him medication to replace dopamine in the brain, which is what is missing in people with Parkinson's disease. And keep in mind that he was at home in this condition for about 10 years like this. Because the doctor who had given him the medication was starting it at an inappropriately high dose, and then the patient had side effects and was very scared to take the medication. Next slide, please. So there are actually many facets of Parkinson's that are important and we are interested in, ranging from, for example, differences in different races, different parts of the world, different manifestations and causes and so on. Next slide, please. All right, so these are some of the papers that we have published over the years. Some of you in the audience here, Yalod and Shen, have been involved in these studies. I mean, some of these papers have been in, I would say, the top journals in the field, like Cancer Neurology, Nature Neurology, and so on. So, hopefully the work that we've done has good visibility and some important impact in the field. Okay, next slide, please. So this is our team. You can see some of the members are here, and it's quite a, you can say a multidisciplinary team. People ranging from, like myself, Parkinson's neurologist, we have neurosurgeon, we have people working in genetics in the laboratory, people who are cell physiologists, and many students as well. Many of them, several of them have been, I'm very proud to say, successful in completing their master or PhD studies. Next slide, please. Thank you. This is just from last week. I was forced to put up 50 as I turned 50. This is my birthday last week. So this is our team. It changes from time to time, but we have some loyal research assistants which have been with us for many years. Next slide, please. So we're interested in trying to understand the disease, which obviously, will then give us ways in which address the symptoms more effectively. Because even though I showed you the medication effect before, and it can be quite effective, but the medication doesn't cure the condition. So we're trying to understand much more about the disease. For example, it's by biology. Next slide, please. So one of the things that we've been very interested in is looking at the genetic aspects of the disease, because in many medical conditions, genetics play an important role. Next slide. And this is just a slide to show that the team at UM, starting from South 15 years ago, Associate Professor Ekwe and Asmina Anwar have been very close collaborating colleagues. Next slide, please. And over the years, we have involved, next slide. We have involved, next one, please. Yeah, many neurologists from different MOH hospitals as well, as you can see. So it's been a very gratifying journey involving colleagues from all these different centers in the Peninsula as well as East Asia. Next slide, please. We even went to Sabah. So we used to be posted, the neurologists would take turns to go to Queen Elizabeth Hospital, because at that time, 15 years ago, there were no neurologists in the public sector in Sabah. This was just, I think, 2 years ago when we went into the kampung in Sabah to see some of these patients with young onset Parkinson's. So people usually think of Parkinson's as something that affects older people in their 60s and 70s, which is true for the most part, but there are also patients who are, in their teens, 20s and 30s developing genetic forms of Parkinson's disease. So this kind of research really helps us understand the disease. Next slide, please. So I don't have time to go into this in detail, how the genetic aspects of the disease now influence our day-to-day clinical as well as research practice. But if there's anybody interested, this is a QR code that you can scan and look at. It's free. It's a very useful platform that gives free educational materials on many different neurology as well as psychiatry topics. And for many years I've been involved in this foundation to produce the Parkinson's-related educational materials. Okay, next slide, please. So one of the projects that we've been involved in is this GP2, or the Global Parkinson's Genetics Program. It's a very large program that, next slide, that is very ambitious. This was the first Asian meeting, which was held in KL last year. We have some people who are very well known. For example, sitting in front, that's Professor Dr. Andy Singleton, who's won the Breakthrough Prize in Medicine earlier this year for discoveries in Parkinson's genetics. So we're quite a high-powered team came to KL for this first Asian meeting of GP2. Next slide, please. We have a lot of very friendly collaborations within Asia. I'm currently the chair for the Movement Disorder Society Asian section. This is one of our meetings last year in Bali. Next slide. And next slide, please. So this is something that actually UM is quite well known for. We are the biggest center in Southeast Asia now performing deep brain stimulation surgery. So we've done about 250 cases, which is, I think, a considerable number for this very high tech kind of procedure. Next slide. And of course, we also publish on what we're doing so that it's clear that our metrics match what is done internationally. And so this is a journal publication in Journal of Parkinson's last year, which showed that our experience over here is pretty good in the hands of our team and specialized PES neurosurgeon, Professor Nalai. Next slide, please. Some of the cases that are referred to us, for example, this young man from HKL, his condition was quite bad initially when he came when he came to clinic, he was always falling asleep. And that was because he was requiring very large doses of Parkinson medication. And after the deep brain stimulation procedure, his medication requirement is much less. I don't have time to show, but this lady on the left side, when she came to us, she was having quite pronounced dyskinesia, a lot of involuntary movements. So we have videos, for example, from her workmates showing her in office having very bad involuntary movements. And after the surgery, which allows medication to be reduced, the condition is improved. Next slide, please. So these are some of the findings in the DBS cohort, which one of the main findings is that earlier surgery actually produces better outcomes. So this is now something I think that is changing also international practice. I wouldn't say that we're the first to say this, but this is actually the first paper in a real world sort of clinical cohort to show this, because before this, the publications were from very specialized university centers in Germany and France. Next slide, please. Next slide. So this is Professor Kalai. It's a very, it's a procedure that requires a high degree of precision carried out successfully. And we are also using the most advanced devices. So for example, this device using AI in a way that can sense brain activity and then modulate brain stimulation. And the first of these devices was implanted by our team in October of last year. Next slide. A lot of what we do in clinic also translates into clinical practice globally, I would say. So I've been involved with this group called EBM, Evidence-Based Medicine Group, for about 12 years. And as part of this group, we publish international guidelines, which I think has a significant impact internationally. So these are very highly utilized and cited. So the older one is about 1,000 over citations. So it's a very useful globally, I would say. Next slide, please. And this is the Malaysian guidelines. You can see 2012 is a long time ago, because we're just recently updated them. But this is on my to-do list. But this is the guidelines that I wrote up with my colleagues, based on this kind of EPM documents that tell us which treatments are efficacious and which ones are less efficacious. Okay, next. Not to forget, although I've been mostly talking about Parkinson's, because Parkinson's is 80% of what we see in our clinics, there are other, even more debilitating diseases. So now, one condition which is actually quite common, I think there's also an epidemic of this condition. It's a so-called Parkinson plus syndrome, which is PSP, progressive palsy. So these patients can be quite disabled. The patient is very uncommon because of having frequent falls due to imbalance. I think you heard about 6 months ago in the newspapers, the daughter of the former Prime Minister of Singapore, Lee Kuan Yew's daughter, right, who herself was a neurologist, actually died from PSP after having the disease for only 4 years. It can be quite an aggressive disease, and here we're trying to find out, for example, the underlying genetic basis, and hopefully have a better way eventually to manage these conditions. Okay, next slide. Okay, so this is, just again, local data that is very, very useful. And this is the first paper highlighting, for example, that it seems that Indian people are overrepresented in PSP, in our PSP cohort. So, of course, in Malaysia, Indians are about maybe 10% or slightly less now of the Malaysian population. If you look at the proportion of PSP patients, it's 25%. So there's something very unusual and interesting and important to work out here. And after this publication, actually in other places like in Toronto, they found the same thing, a high proportion of Indians. And again, you don't have 25% of people in Toronto who are Indians, it's less than 10%. So this is a very interesting observation. Next slide, please. And then I'm finishing. This is just a plug for my friends in the US. It's a very important book. The foreword is written by a senator and a congressperson in the US. This is talking about the Parkinson's pandemic. It is really something that is increasing, not just because of population aging, but probably other factors, such as environmental toxicants, so pesticides, use of different kinds of chemicals for cleaning, dry cleaning machines. These get into the brain and can trigger Parkinson's disease. even add emotion. So this is actually very important. This is now one of the top sellers in Amazon. So if you have a chance to get it, it's a fantastic book. I've read an advanced copy of it. I think that's the last slide. Can you move on to the next one? It's just a next one. Yeah, this is just a collage next of patients that we see. Next is the shape for helping. So like, these are all our patients. We have so many patients. And these are actually patients with a specific genetic variant in the LAMP2 gene that increases their risk of causing Parkinson's. It's seen only, interestingly, in Chinese and Malays, and not in Indians. So again, Indian people, genetic factors are different, and so that's something else that has to be worked out. Okay, next slide. That's it. Thank you. So happy to take questions.
Thank you very much, Prof. Shen, for the very insightful presentation just now. So now we open the floor for questions from the audience. Yes.
Hello, testing. Hi, Prof. Shen. Since I'm the one who will invite you to come to talk, I have to ask a few questions. So just two things. I'm sure you have been treating movement disorders for a long time, especially Parkinson. In terms of awareness in a local setting, when you observe the referral to you, do you receive a referral maybe from neurologists, or there are more and more patients who actually come to you as self-referred cases nowadays? So that is one. The second thing is, I noticed your guideline was in 2012. So if you have a chance to actually update this particular guideline, what are the new things that you probably will put it in that you practice differently compared to 10 years ago?
So thanks, Prof. Going for the nice questions. So for the first one, actually, we get referrals from all over, I would say. Some are from neurologists. For example, if they are encountering cases that are very difficult to treat, sometimes they're not Parkinson's, so they can be Parkinson's plus. And so we have a disproportionate number of very challenging cases that don't respond to simple treatment. And so they're referred to us. Some are also referred by the neurologist for the deep brain stimulation, because that in Malaysia, actually, there are only 2 centers probably that do this on a very regular basis ourselves. This is partly under UMSC, private wing, as well as under UMMC. And then the other center is in Penang, which is Island Hospital, and it's a private hospital. So of course the charges are significantly higher. On the other hand, now, as you said, patients are, educated, internet, and pick things very quickly. So we have patients also who are self-referred. They will write to us and look up our, email and write to us directly. And some of them actually will even approach us for clinic appointments before they have Parkinson's. So there are certain symptoms that can predate the onset of the movement problem, sometimes even by 10 years or 20 years. So there's a kind of sleep disorder that is very peculiar, and it very commonly in Parkinson's patients called RPE, where the patients are having dreams, often nightmares, and they're acting out, they're shouting, punching, kicking. Just now in my clinic, I had one patient who fell out of bed from having these sort of nighttime sleep problems. And so we even have patients who write to us and say, "Doctor, I'm having RPE. I'm very concerned about the possibility of developing Parkinson's. Can I come and see you?" So it's a mix, I would say, of patients across the spectrum. In terms of the consensus guidelines, this is in 2012. We do have some new medication treatments that are not in the 2012 guidelines. So, for example, some of them are, I would say, these more modern iterations of compounds that we already had before in the same class, but maybe more effective and more convenient. So, for example, although it's completely harmless, doesn't harm the kidneys. You've never seen any of our patients, referred to you because of kidney damage from Epicode. It doesn't, but it has these drawbacks. So the most recent one is Epicode, which is given once a day, and so that's very convenient. There are new class medications as well. So, and then things like deep brain stimulation. Already this has been available actually for 30 years, but there are recent developments. So, for example, Whereas before, the battery would last maybe about 5 years and then you have to changing it, very expensive, like a pacemaker battery. Now the newest batteries can last for the patient's lifetime. So these are some things that are, I think, very worthwhile to update.
Yeah.
It's,
Thanks.
how often do you update yours, may I ask? For your technology?
The last one was 2018. So yeah, but our updated process has started.
Well, the nephrologists are always ahead of us. Also, many more of you compared to neurologists.
I think in the Parkinson's area, probably the cohort is still smaller, not the subspecialties actually. But you're all very subspecialized. Compared to the nephrologists, we are more generalists. Yeah. I'll leave the question to others, even though I still want to talk to you about some other things. Yeah.
Thank you very much, Prof. That's so good. And also, Prof, for sharing and having friends and also the consensus in that mind. All right, so we have the next question. Yes. Thank you, Prof. It was a very informative talk. So I'm actually Mohita from CIC as well. As we all normally think that autism is something that affects the older or elderly population, but as from what I saw earlier, there are also some young ones that are affected. So my question is to know like what are the challenges you face when, especially with those younger population, and how do you navigate especially with regards to this autism?
So thank you for that question. So first of all, probably to say that we try and avoid using the term elderly, especially if there are geriatricians around, you get a thump on the head. So luckily there are no geriatricians. But you're right, the majority of Parkinson's patients are in the age group are 60s, 70s and beyond. But because we are specialist centered, we also see the unusual ones. So our youngest patient actually had Parkinson's onset at the age of 16, which is very young. Now, obviously in the younger age group, there are some of the considerations are different compared to older people. So for example, issues to do with employment, issues to do with still bringing up children, issues to do with, in the case of women, pregnancy, what to do, for example, with drugs, right? And then also younger people tend to have a problem that we call this class of problems motor response complications. So younger people, the brain is different. So when they are given Parkinson's medication, the medication is effective, but the brain can respond to it sometimes in the long term in detrimental ways. So for example, when they take the medication works, they can move, but sometimes the effect is too strong and they get excessive movement, from no movement to excessive movement. So these are additional considerations in younger people. It's a big topic. I mean, actually treatments like deep brain stimulation has made a big difference for many young people with Parkinson's disease. Because DBS actually is primarily to treat these motor response complications where they get, off-on fluctuations, dyskinesias, and so on. I hope I'm not being too technical, but the treatment is primarily aimed for this kind of problem.
So much love. That's very well, isn't it?
Thank you.
Thank you very much. Questions? Yes?
Hi, Dr. My name is Ashraf from CIC. So, I've been living with family members of Parkinson's. Started with my grandfather, who has Parkinson's. And at an early age, he's, I look at recently, he cannot even move from the bed. So, we have to take care of him. And then, now my father also has some signs of Parkinson's, tremors, So, and then the gait and the face also. So, I'm very curious what are the progression of the Parkinsonism, and then
What are
the progression will be for Parkinsonism, and then how will it affect the hereditary part of the Parkinsonism. So, it will be time for your advice is to seek treatment, when to seek treatment.
Okay, thank you. So there are a few facets to this, I would say. The first thing you mentioned about having family members, I think almost everybody will have family members, someone they know, friends affected by Parkinson's. So it's, as I said, it's a pandemic. Now, coming specifically to your family's situation, sometimes in the older generation, there may not have been a clear-cut diagnosis of Parkinson's. I'm not sure your grandfather was he actually diagnosed by a doctor saying that he had Parkinson's or not. So sometimes it can be just, slow movement, tremor, or what. It could be other causes. Sometimes, for example, even strokes, certain psychiatry medications can cause Parkinson's-like symptoms. Now, assuming that your grandfather, your father's father really had Parkinson's disease, and now your father also has Parkinson's disease, obviously that is a concern. We do see patients with this pattern of transmission. So in general, again, hopefully without getting too technical, but in general, medical conditions can be genetic. It can be autosomal dominant, where it passes down through generations, or it can be autosomal recessive, where a person inherits two abnormal copies from parents who are usually clinically unaffected. They have one abnormal copy, but you need two abnormal copies of the gene to express the disease. So, in your case, it sounds like potentially it could be autosomal dominant transmission, which actually so far, based on research that we've been doing, and we have collected more than 3,000 Parkinson's patient DNA samples over the years. Autosomal dominant forms of Parkinson's disease in the Malaysian population, whether it's Malay, Chinese, or Indians, it's actually very rare, thankfully. But we do see it. Much more common are the autosomal recessive forms, where in that case, then when you see a patient, then you'll be more concerned about their siblings being affected, because then it's 1 in 4 chance that the siblings will have the disease. So I would say that, now there are people who would go for direct consumer gene testing. You can provide a saliva sample, a blood sample, send it off to Korea, US, and so on. There's some people who do that. Of course, you can always go and consult a neurologist who has an interest in this kind of area, and they can talk to people who examine you, see whether there are any symptoms to be concerned about, and consider predictive testing. For the most part, we are not doing testing for people who are clinically unaffected. Now, this is in this current state where we don't have any treatments that can clearly prevent Parkinson's. When we do, then that obviously changes things. Then you would want to know, hopefully as soon as possible. But right now, there are a few things that one can do to reduce the risk of developing Parkinson's. That is, number 1, exercise, interestingly. Number 2, coffee or caffeine intake. So if you like coffee, tea, like tea, green tea, that has been actually shown by multiple epidemiological studies to be associated with lower risk of developing Parkinson's. So that's also an interesting thing. And there was a paper just published last week on metabolic syndrome. So Prof will know a lot about this. Patients with diabetes, hypertension, kidney disease also increases risk of developing Parkinson's, and not just Parkinson's, actually dementia, Alzheimer's dementia, vascular dementia. All these things also relate to lifestyle as well. But coming to your question about the progression, again, this is a big topic. So, and partly it has to do with genetic factors. Like today in clinic, I saw one patient. I've not seen him this now, we're next clinic sometimes, but I've not seen him for 10 years. And then I thought, well, 10 years, long time, probably he'll be, more disabled. But no, he breezed into my room. So he's had Parkinson's for 22 years, and he's independent in his activities of daily living and still doing house chores. So he has, but again, he had Parkinson's onset in his 30s. So he's young onset Parkinson's, now in his 50s. But the progression has been relatively slow. But there are other forms of Parkinson's where the progression can be, even within 5 years, it might already start to need to use walking, sometimes even a wheelchair. So part of it is we can now sort of predict by doing genetic tests, but it's still we're still not able to predict very, very accurately what the prognosis will be. I hope that answers your question.
Thank you very much for sharing, especially the factors affecting the condition itself. Is there any further questions from the floor? It's probably
Thanks for sharing the good news that caffeine intake actually reduce the risk of Parkinson for coffee level like us. One of us, how many of you have? For the meantime, I'm still quite disciplined, maybe the two a day. Hopefully, it's not too much. Something related to CIC. Because I noticed neurologists do not actually come to CIC to do a lot of clinical trials. I'm not sure whether is it because you actually rejected the kind of feasibility for clinical trials in Parkinson, or there are actually not many. I'm sure there are many therapeutics trial, right? So that is one. I just want to know why we do not actually see that many at CIC. The second thing is, you know that we are developing our phase 1 unit now. So I want to invite you to start thinking, is there any potential for your Parkinson research area to actually utilize our phase 1 unit for early phases kind of trial study?
So, in answer to your first question, why we are not, conducting or being part of like international multi-center trials. I was involved when I first came back and inherited some studies actually from Prof. So, like one of the new drugs that I mentioned first in the class, BOD inhibitor slash other actions, is called safinamide. So now it's licensed, and we were actually one of the centers taking part in that multi-center international study. Now, why we don't have not carried that on? I think there are two major factors. One is that the companies have not really come very much. There have been some, requests for information from others, expression of interest and so on, but not that many, I would say. That's one. The second one is, I think it comes back to the fact that, unfortunately, in neurological diseases, the assessment of patients is very time-consuming. So we don't have, EGFR or protein excretion or HbA1c, and then you get a very good snapshot. It can even be used as a primary outcome measure. In Parkinson's disease, we have the UPDRS, which is multi-page document where you assess the patient from head to toe in terms of their motor and non-motor symptoms and examination. So it's very time-consuming to do this. And as you said, we have, we don't have that many people on the ground in terms of being able to do these scales now. So like at UM, we have two neurologists who are dedicated for doing PD, and we are already up to here in terms of our clinical as well as research commitments. So I think those are the two issues. I must say, and this is not, I don't mean this in any way to reflect poorly on CIC. But the other thing is, when these companies have approached us, the way they ask for information is like they want it yesterday, kind of thing. And so many questions. And then on the occasions that I have provided it, after that you won't hear anything. So even if they don't want to recruit our center, they should out of politeness say, oh, we assess, either, Malaysia is not attractive enough, not enough sites or what. But we don't hear anything back, which is actually quite poor. So we reply very quickly, and then you don't get any answer or follow up. So I think that has to be. Your second question is
Phase 1 unit.
oh yes, sorry, short-term memory is very short. Phase 1, yeah, I think. So to be honest, I would say that we are involved in many, many different spheres of Parkinson's research. But if you ask me, are we cutting edge enough to be, coming out with compounds to test at such an early stage? Phase 1 means in healthy humans, right? I don't think we are quite there. But I mean, this is a bit chicken and egg. We never even considered it because it's not something that I was previously aware of until very recently. So we can start thinking about this and looking out for possibilities. I know, for example, that there are people in different departments and faculty of medicine who have been interested in looking at things like supplements derived from mushrooms and so on. Yeah, so maybe it could be tested in humans. Yeah. But I would see my role mostly probably involved in phase 2 and phase 3 now, as in we have the rapport with our patients, we have a very large cohort, so it makes sense to build on that rather than go and find probably CIC does this, right? You have a pool of healthy volunteers that are happy to take part in these studies.
So I suppose our phase 1 unit is very early. It's still under renovation. Probably accreditation might be obtained early next year. So of course they need time to build the reputation for big company to come, and engage us in the phase 1. But I suppose we have to start somewhere by probably doing a smaller scale local company, the kind of early phase study to build our reputation. But I think we probably will need to give more information to all our potential investigators, so that's more well aware. As you said, you might not be aware until very recently, right? We are working on the phase 1.
Thanks for bringing that up.
Yeah.
Thank you very much for answering so good. Any other questions from the floor? Okay. So before we wrap up our session, maybe just one last question from us. So looking ahead, maybe Prof will share what are the next steps for your hopes for the patients Parkinson's disease in terms of like clinical care and also in research. We have a lot of young researchers as well here.
Yeah, I mean, it's not a nice disease to have, that's for sure. I mean, there are people like if you look the example 20 over years, able to function quite well. I would say that's an exception, but many more people face huge challenges with their Parkinson's disease. It's very bad in terms of the movement problems that they have and a whole variety of non-movement issues, long-term developing cognitive problems and so on. So I think, we do what we can. We are always trying to frame things in a positive way for patients. I have never, despite the fact that I see so many very difficult cases, I've never said to a patient there's nothing more we can do for you. There's always something that we can still say or do or try. Obviously we don't want to do things that incur side effects and things like that. But I think we need to be hopeful, optimistic, positive for patients. And I think that in the coming years, the brain is the final frontier actually in terms of human biology. Many organs are much more easy to understand in terms of the complexity. It's much less compared to the brain. And I think in terms of sheer numbers, things like dementia, this is the thing that society will have to grapple with as the number one problem in the years to come. Already now. So I'm hopeful, even after seeing, I think, patients for 20 over years, or even neurology patients for 20 over years. I never discourage people from going into neurology. I don't know if I highly encourage them, but I never discourage them from coming into neurology. It's a good field. If you have the endurance and the mindset for it. I think research has a lot of research ongoing. One of the good things, for example, in the Parkinson's genetics area is that there are some very rich people. This is public knowledge, so I'm not disclosing anything confidential, but the co-founder of Google. So the family, his mother has Parkinson's and has the LAT2 gene. He has the LAT2 gene mutation without.
Thank you very much for the insightful session and also the valuable and inspiring sharing by Prof. Shen. So again, if there is any other question from the floor. Okay. So before we conclude, we would like to invite Professor Dr. Lim Sukun to come on stage to provide Prof. Shen with a token of appreciation from CIC as a gesture of gratitude. So once again, let's give a warm a round of applause to Prof. Dr. Shen. And thank you very much for our audience also for the very thoughtful participation. We hope today's session has given you a glimpse of how research, particularly in Parkinson and movement disorder, can truly touch lives. So do stay with us for our next session tomorrow, which begins at 8 a.m., where we will touch on the telemedicine advancement and also AI-based radiotherapy in cancers. With that, enjoy the rest of the UMMC 57th anniversary celebration and have a good day.